Hi, welcome to Therapy Playground. I'm Julieanne.
And I'm Melissa.
Melissa and I are both CFYs here at Therapy Playground, and that means we are in our clinical fellowship year. We both went to North Carolina Central University and got our master's degree, and then we ended up working at Therapy Playground together. My experience as a CFY was a little bit different than Melissa's, and we are both going to share some of the things that we learned and some of the things that really helped us grow into the therapist that we are today. My experience was different because I was able to do an internship here before I started, and Melissa, having done internships other places, came in as a fresh new grad student with no clue what Therapy Playground was like. As a matter of fact, Melissa ended up working here at Therapy Playground because we were both sitting in class one day and I said, you should apply here.
And so I did, and here I am, and it's been a wonderful experience so far. Hopefully today this video will give insight to others who are thinking about becoming a speech language pathologist and what it takes to get to this point. This point has brought us here. It's been a lot of sweat, blood, and tears, a lot of studying, a lot of supervision, a lot of research on different types of language and speech disorders. We've done a lot of different things. We've also been to some conferences to also help us with learning about different children and learning about feeding disorders and a whole array of different things here while I play at Therapy Playground.
So, Melissa, what are some of the main things that you enjoyed about your CFY year?
I love the flexibility. I get to go into different areas. It's not just staying in one room all day. I have met some wonderful families that I've been able to go into their home, meet them, talk with them, talk about their concerns with their children, as well as go into the clinic and be able to kind of set my room up and get my own type of flavor and things, and work with different children as well. That's been probably the best experience of this whole CFY. What about yours?
Like I said, my experience is a little bit different. I started here at Therapy Playground working in the office before I even started grad school. I did authorizations and all that stuff, and I am just so happy to be done and out of that office. But I don't actually have my own office yet at Therapy Playground because I've been traveling so much. I started working in Robeson County, and as far as I went, I've gone all the way almost to the South Carolina border seeing kids. I went to Exit 2, all the way in Maxton to see kids, an hour and a half of travel, which I didn't mind. You know, I like my travel time, but it was really worth it getting out there to see the kids. I've been working with the bilingual population. I speak some Spanish, so being able to work with those kids and you know, go into the home and learning more about the culture and the, you know, the grateful families, you know, grateful that I'm there and, you know, can give therapy to their kid in 2 languages, you know, that's really beneficial and rewarding for me. And then, just like you said, learning about feeding, you know, disorders and feeding therapy, and that's, you know, I really love feeding therapy. I love working with the kids, and that's been really interesting and, you know, something that I've learned during my CF that you know, we touched on in school, but we didn't get into, you know, full depth. And I've now been to 3 different feeding conferences, so, you know, I feel pretty skilled in that area, whereas other, you know, students that we graduated with, you know, may not have the opportunity to learn about feeding as we did. As a matter of fact, I did an evaluation on a kid in Robeson County, who the speech therapist did a language evaluation, but she didn't feel comfortable to do a feeding evaluation, so they were referred to us for a feeding evaluation, and that girl actually graduated in our class. So that was pretty interesting to be able to cross paths, you know, and kind of see the benefits of, you know, where we were at and what we've learned.
And it was a brand new experience for me. During my interview, I remember Jen asking me if I was okay with feeding therapy. I said, I don't know, but I'll give it a shot. I'm willing to do almost anything and learn about new things as it is. But I think coming here and not having that prior experience like Julieanne did as she did in her internship, it was a whole new world for me. I had to learn and go review my anatomy and my physiology. I had to learn different techniques and learn about different motor behaviors, different sensory behaviors, different behavioral things, and be able to assess and also treat. So that was one of my challenges that I had while coming here because I did not have that prior experience. Even though I did do an internship in the hospital setting in Goldsboro, Way Memorial, we only visited with the older population. So I did not know what to do when there's a baby sitting in my arms and, you know, the baby has a G-tube and all the different things that come along with that. So I definitely learned a whole lot, and I'm still learning as well. So that was one of my challenges.
One thing that I learned was, you know, giving evaluations. In school, we gave evaluations. We gave them to school-age children, and I think I gave maybe like 1 or 2 to preschool-age children. And here we are in this pediatric clinic, and you and I both did evaluations for the CDSA.
Yes.
So we were seeing 3 and under having to give the PLS over and over and over again. And I think
Really
before
good.
I graduated, I did 1 PLS. Okay, so, you know, once, you know, we got in working, having to give those evaluations, one thing I learned was, you know, when to give credit for something and when not to give credit, and, you know, to end up with the score that you feel the child should have. Not, I'm not saying that you make up the score yourself, but if, as a speech therapist, you can look at a child and say, you know, I think they're going to be, you know, moderately delayed. You can look at them and tell. And, you know, you don't want to give a test and then all of a sudden you're like, well, they need therapy, but per this, they don't qualify. Right. You need to know how to give it and how to give it correctly. And I think that's something that I learned, you know, as well as creating the goals, because I don't think we really created goals. They were already made for us, you know, and most of the time. Most situations. And then we just did the therapy. So creating goals was something new that I had trouble with, that I had to learn to do. And, you know, in the beginning, I sat there and I was like, I don't know. And my supervisor was like, I think they need this, and they need this. And I'm sitting here feeling so inadequate. Now, you know, I'm giving the test and I can bust out the goals like that. And I know exactly what this kid needs. And that's, you know, that's something that I've learned and I feel really confident about.
And that's what the CFY experience is. You know, we're fresh out of school. You know, we are not the perfect therapists who've been trained for 20 years. We're fresh, we're new, so we've had to kind of make some mistakes along the way and then learn from our mistakes and become better because of it. So that's really what the CFY experience is all about, is, you know, making sure that you're going to be competent and comfortable and able to handle it by yourself. So I am very appreciative for this experience and for the 9 months to be able to have someone come along with me, not there all of the time, but, you know, once a month able to ask questions, as well as ask questions to other therapists. Your supervisor may not be around you all the time, and you may just be around I think we're lucky enough to have other therapists around us where I can bounce ideas like off of Julieanne and she can tell me, you know, some of her ideas, or I can bounce an idea off another therapist and we can kind of collaborate and figure out what's the best thing for this child.
Yeah. You know, I'm glad you said that, because that's one thing that I really love about Therapy Playground is that even though we're new grads, you know, we've come out of school with fresh information.
Right.
So we have a fresh outlook, and, you know, there are other people that, you know, have a different outlook, and we can come together and collaborate and think of these great ideas. I like that here at Therapy Playground, everyone, you know, is on the same level. Right. And, you know, I feel comfortable going to my peers and, you know, asking them, hey, what do you think about this kid? You know, I have this case and blah, 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 and this is what I was thinking. What do you think? And, you know, we can bounce ideas back and forth off of each other, and I think that's great. You know, another thing is we have OTs, PTs, so we can get information from them as well. If we have kids with sensory processing problems, we're having trouble with behaviors in therapy, then we can, you know, talk to our OT about that. One thing I thought was great that Melissa and I both had to give a presentation. So we did, like, it was like hour and a half, 2 hours, and we ended up giving a 2-hour presentation, and then a month later we gave another presentation, you know, that was relating to the same subject. And I found that, you know, we learned a lot through that process, and we actually had therapists coming to us that have been, you know, doing therapy for like 15 or so years, asking our opinion. And I thought that was really cool.
Feels good.
Yeah. To, you know something and feel like you really know it, to where you can give advice to other people. And I thought that was really interesting.
And feel really comfortable and competent in that information, as well as use it on the children that you serve. You can also, like, you know, pinpoint, okay, we did this presentation, and you're actually seeing it in your kids, and then you're making them better by using the different techniques and using the different tools that we did learn during our presentation. So ultimately, it has made us better therapists.
So, for anyone out there who is thinking about becoming a speech language pathologist or is looking for a place to do your CFY, I would recommend finding a place that, that you have good supervision, that you're going to have someone there that you feel comfortable going to and asking them questions, or that's going to give you true and honest feedback, because we've actually had people that we went to school with who quit their CFY in the middle and had to find another one because they weren't getting good supervision or they felt uncomfortable in the place. So I think it's really important to get that supervision. We also have therapists here who did their CFYs at other locations, and they said that they felt like that whole year was wasted because they didn't have good supervision. They didn't learn as much as they should have, and they learned more afterwards coming, here to Therapy Playground and being able to bounce ideas off of other therapists than they should have learned in their CF. And I think that we were really lucky to be able to be at a location where we, felt comfortable and we had our peers around us to,
help us out when we needed a question answered, or if you just didn't know what to do about the situation you've never seen. Because granted, in graduate school, we go over a lot of information, but it's different than having the experience and seeing it firsthand. And your teachers and your professors are not there with you because you've already graduated, you're done. So it's really good to be in a good place where there are people who are knowledgeable about a lot of different areas that you may not feel competent and comfortable with, that you can always go and bounce those ideas off of them and then also learn at the same time. So that's wonderful.
Yeah, so if there's anyone out there who's looking for a place to do your CFY and you're interested in Therapy Playground, feel free to contact us at therapyplayground.com. You can find our address and our phone number on there. You give us a call and we'll give you information. But I hope you learned a lot, and thank you for listening.
Thank you.